So today I'm going to be treating the back using the Enraf Nonius Tecarpuls. We're going to back and pre-treatment mobilization. As you can see here, it's preloaded the machine at level 10, which is its highest setting, and 8 minutes. I like to use 1 minute per treatment head, so 8 minutes is going to cover a large area of the back. Heating the back up pre-mobilization is fairly common. We'll have a look here at the back. I'm just going to take the earthing electrode and apply a little bit of contact medium to it. So we'll get this earthing electrode and contact medium applied to the patient, spread out the contact medium, and then just make sure that it has to skin contact on the patient. I'm back now. I'm going to apply some contact medium to the patient, apply it around the area you want to treat. If you were doing just one side of the back, you would probably do about half the time. So if you were doing just the right hand side facet joints, you would just do half the time. If you were just doing central and the right hand side, you'd probably still do half the time. Of course, if you're doing both sides of the back, then you're going to want the full 8 minutes, and on a larger area even more, depending on how much of the back you intend to treat. So as you can see here, I've started the Tecarpuls and I'm just moving around in fairly rapid circles. I'm just trying to put some heat in. At level 10, that should be pretty quick. The patient should at some point be saying that it's getting too warm and needs it turning down. That's perfectly fine. You just turn it down. Make sure you've got heat into the tissues. Preheating the spine prior to mobilization is not uncommon at all. Probably the most common way of doing it is using hydrocollator pack, so a wet heat pack to add the heat pre-mobilization. Of course, the Tecar is a lot more efficient than that. A hot pack to the back would take probably 10 to 20 minutes. The Tecar in this case is going to take 8 and will be significantly deeper. A lot of patients like the preheating prior to mobilization. A lot of therapists like it because they say they can move and mobilize more. It's just easier to do. Some people actually do this treatment post-mobilization to relax the patient down and relax any muscle spasm they might have caused. So it's perfectly okay to do this treatment pre or post-mobilization. It would be exactly the same. This is a long treatment, so I'm going to skip forward now to the end of the video.